Some people using hallucinogenic drugs can re-experience the effects of the drug days, weeks, or even years after they used it. This is called hallucinogen persisting perception disorder. These experiences are commonly called flashbacks. The common term trip refers to a drug-induced inner neurological experience in which sensory perception is altered while taking hallucinogenic drugs. For many, this can be a life-enhancing experience. However, tripping on hallucinogens is potentially quite dangerous. Depending on the kind of hallucinogen, the amount taken, interactions with medications or underlying medical conditions. During some flashbacks, the sensation relieving the trip or the effects of the drug is pleasant. It may actually be relaxing and enjoyable. However, some people have a different flashback experience. Instead of a pleasurable trip, they experience perplexing visual effects only. These visual effects may include halos around objects, distorted sizes or colors, bright lights that won't fade. People experiencing these disturbances may be entirely aware of everything else that's happening. The interruption in your field of vision can be annoying, disturbing, and possibly debilitating. That's why these symptoms may be unsettling or upsetting. If these visual disturbances occur frequently, you may have a condition called hallucinogen persisting perception disorder. HPPD is considered rare. It's unclear how many people experience this condition because people with a history of recreational drug use may not feel comfortable admitting to their doctor. Likewise, doctors may not be familiar with the condition despite its official recognition in medical curriculum and diagnostic manuals. Researchers have recognized two forms of HPPD, type 1 and type 2. Type 1 HPPD is typically experienced brief, random flashbacks, disturbing and pervasive. Because so few cases of HPPD are officially diagnosed, research is quite limited. That makes what doctors and researchers do know about the condition limited as well. Flashbacks are a feeling that you are reliving an experience from your past. Some flashbacks occur after drug use. Others may occur after traumatic event. With HPPD, however, flashbacks are not as comprehensive. The only effect of the flashback you will experience is visual disruption. Everything else will be the same. You will be aware of the effects of the disturbances, but you likely will not enjoy the other effects of relieving a trip. As the flashbacks become more common, they can become frustrating, even overwhelming. People who experience visual disturbances caused by HPPD often see colorful objects seem bright and more vivid. Bold bursts of unexplained color may pop into your field of vision. You may have a difficult time telling similar colors apart, and you may also swap colors in your brain. What is actually red to everyone else may appear an entirely different color to you. During an HPPD episode, you will know that your experiencing is not normal. This may make you feel as if something bizarre or unusual is happening, which can lead to an uncomfortable or embarrassing feeling. It's not clear how or why HPPD flashbacks occur, so one can happen at any time. These flashbacks are rarely as intense or long-lasting as a typical drug-induced trip. It's common for people with HPPD to experience anxiety or panic disorders. Researchers and doctors do not yet have a solid understanding of who develops HPPD and why. It's also unclear what causes HPPD in the first place. The strongest connection points to a history of hallucinogenic drug use, but it's not clear how the type of drug or the frequency of drug use may affect who develops HPPD. The number of people with HPPD is low, and it's more often diagnosed in those with a history of previous psychological issues or substance use. However, it can arise in anyone. even after a single exposure to triggering drugs. In some cases, people experience HPPD after their very first use of a drug. Other people use these drugs for many years before experiencing symptoms. Lingering symptoms are not the result of a bad trip. Some people may first develop HPPD after a bad trip, but not everyone with HPPD has experienced a bad trip. These symptoms are not the result of the drug being stored in your body and then released later. This myth is common but not at all true. HPPD also is not the result of current intoxication. Many people first experience symptoms of HPPD days, weeks, even months after drug use. If you experience unexplained hallucinations, it's important to see a doctor. Any and all hallucinogenic episodes are of concern. This is especially true if you experience these episodes frequently. The doctor may perform an examination, obtain laboratory tests, and take an image of your brain. In some cases, they may want to perform an electroencephalogram to monitor the brain's electrical activity. If you've used hallucinogenic drugs, you should let your doctor know. It's important to understand that your doctor's primary concern will be helping you address and treat your symptoms. They are not going to judge your previous or recent drug use. If the doctor performs a medical evaluation and the testing and imaging results are clear, they may recommend a psychiatric examination. If a psychiatric evaluation does not fit with other more common diagnoses, HPPD may be the resulting diagnosis. Reaching an HPPD diagnosis may be easier if your doctor is familiar with the condition and your past drug use. Your doctor will want to know your personal health history, as well as a detailed account of what you've experienced. If your doctor suspects another possible cause, such as side effects of a medication, they may request blood tests or imaging tests. These tests can help them eliminate other possible causes of your symptoms. If other tests come back negative, an HPPD diagnosis is likely. To have an effective doctor-patient relationship, it's important that you can be honest with your doctor about all your behaviors, choices, and health history. These factors will help your doctor reach a diagnosis and help you avoid possible complications from drug interactions. If you feel your doctor is not treating you properly or taking your symptoms seriously, find a doctor who makes you comfortable. HPPD has no recognized medical treatment. Since so little is known about the development of HPPD, it can be difficult to find a psychiatrist with experience treating it. Finding a way to ease the visual disturbances and treat the related physical symptoms may take a bit of a trial and error. Some people do not need treatment. In a matter of weeks or months, the symptoms may disappear. A 2021 review of HPPD suggests certain medications may help treat HPPD, but those studies are limited. Anti-seizure and epilepsy medications like clonazepam and lamotrigine are sometimes prescribed. However, what works for one person may not work for another because the visual episodes of HPPD can be unpredictable. You may want to prepare yourself with techniques for handling the symptoms when they do happen. For example, you may need to rest and use calming breathing techniques if these episodes cause you significant anxiety. Worrying about having an HPPD episode could actually make you more likely to experience one. Fatigue and stress may also trigger an episode. Talk therapy could be a helpful coping option. A therapist or psychologist can help you learn how to respond to stressors when they occur. If you enjoyed this video, subscribe, like, share, and comment.